Welcome everyone. So today I am presenting on breast cancer while breast and chest feeding. And my name is Haley. So introduction, this presentation will discuss breast/chest cancer and the obstacles that many parents overcome in order to feed their babies. Please note that breast/chest cancer is out of a lot of individuals' control, and more research is needed in order to support these parents and newborns during breast or chest feeding. Background information. So, in the United States, breast cancer accounts for 30% of all cancer diagnoses. In addition to this high percentage, cancer is the second leading cause, followed behind cardiovascular disease, of death among women. Sorry, I'm sick, so bear with me. Please note that research appears mixed on whether cardiovascular disease or breast cancer is the leading cause of death between the ages of 20 to 49. So I tried really hard in this presentation and the information that I provide to not dive into breast cancer above the age of 50, because typically a lot of our moms are out of hitting menopause and out of reproductive age. So I tried to kind of narrow down my research into the age of these individuals that are going to be having babies, because that information seems like the most vital for incorporating lactating information. So the information on that was a little mixed of if breast cancer during this stage or cardiovascular disease is the leading cause of death. Research shows that there is a lack of knowledge amongst providers and IBCLCs. Some insist on avoiding nursing altogether, while others lack experience and knowledge on guiding these parents. Not 100% sure how to say these names, but Burossi and Heckman's study reviewed 13 individual studies regarding nursing after breast or chest cancer treatment. This study examines reasons for continued nursing and the reasons some parents chose to discontinue breastfeeding. Reasons parents were able to breast or chest feed. Having a deep desire to breastfeed. That was really important to some parents, and they really wanted to stick through those early days and challenges. The parent was done with treatment. If the parent is still undergoing treatment, depending on what that treatment is, such as chemotherapy medications, radiation, just had surgery, it is very dependent. If they're obviously recovering from surgery, it's very difficult to nurse. If they are on certain medications, that medication gets transferred through the breast milk, and can actually be harmful for the baby. So that is a key piece of information, that they are safe to nurse their child, depending on the medication that they are on. Sorry. Only one breast was affected, therefore parents were able to nurse on the opposite side. They were supported by providers and IBCLCs. This was a big discussion within this study that I looked at. Almost everyone said if they were supported and had good information, it made nursing a lot easier. That they were nursing often, and the use of medications or supplementations to increase their breast milk. A lot of parents that have had cancer, one of the biggest struggles is their supply. So increasing the supply is important. A lot of parents indicated that their supply was good in the first 2 weeks, and then it was almost gone after that. So that was an important factor. Reasons parents discontinued: lack of information around breastfeeding, chest feeding, and cancer, lack of support from their providers or IBCLC, pain at the nipple or breast, lack of milk supply, newborns unable to latch, and difficulty relying on one breast. One thing that I do want to state is some of this information was a little bit tricky to decipher. If we're stating that the reason the parent stopped breast or chest feeding because of the newborn having a difficult time latching, is there other factors in there? So that's important to look at. Is there factors that, well, was the baby premature? Did the baby have lip or tongue ties? What was the reason for the baby being unable to latch? Was it because the nipple was deformed, or the breast milk wasn't coming out? Like, there's a lot of reasons to discuss in there. So it's important for some of this information that I think it's important for some of this information to say, like, we still have more questions. There's still more research that needs to be done, because we can't just say the newborn wasn't able to latch because the parent had breast cancer previously. That seems silly. Seems like there's a lot more questions to be asking. So to statistics, 1 in 8 women, 13.1, will be diagnosed with breast cancer in the United States. 1 out of 43 will die from this diagnosis. And people diagnosed between the ages of 20 to 49 typically have an aggressive form of breast cancer. During Bursi and Heckman's study, they looked at, one of their studies looked at a group of people from Belgium, Denmark, Spain, Italy, Lebanon, and the United States. They stated that of 333 people, 13.3 breastfed, 39 did not, and 66 were unknown. 5 out of 10 breast cancer diagnosis is developed from an inherited gene called the BRCA1 and BRCA2. 7 out of 10 people with this gene mutation will develop cancer before the age of 80. And the risk of breast cancer is reduced by 4.3 for every 12 months that you breastfeed. Risk factors for lactating parents. Individuals with a history of breast or chest cancer will have increased risk factors, 1, in their family for developing cancer, and 2, more complications that can arise from being able to nurse. Environmental exposures, and then people with a gene mutation from the following genes. So we all have these following genes. It's about if the gene is mutated, that it can increase the risk of breast cancer. So the 2 most common are BRCA1 and 2. These genes make protein and repair DNA, but if they are damaged, it will become mutated, and this can lead to abnormal cell growth. For the purpose of time, I'm not going to run through every single one, but just know that these other ones can indicate an increased risk of breast cancer. And people that have undergone treatment for breast cancer, such as chemotherapy, radiation, and surgery, might have more difficulty being able to nurse. Risk factors for the newborn. Increased risk for dehydration and slow weight gain. So if you have a birthing parent that is really, really insistent on that they are going to breast or chest feed their baby, it's important to make sure we are watching for weight gain and that baby is not getting too dehydrated. It's really common for these parents to have a low milk supply, so we want to ensure that baby is getting enough. Difficulty latching due to abnormalities. Again, this question or this statement, it needs to be dived into a little bit more, which the research just isn't there, to figure out why the baby isn't latching. Is it actually a parent issue or from the breast, or is it actually a baby issue? Side effects from medication, which we already talked a little bit about. If the parent is on medications, then it might be wise to discontinue due to side effects for the baby. And there is no risk of the baby developing cancer from the breast or chest, just from the milk alone. Cancer cells do not transfer into the milk. Shared decision making. All clients should be provided with evidence-based information when choosing to breast or chest feed for their newborn during or after a breast cancer diagnosis. Clients should be provided with the following information: risk for themselves, risk for newborn, statistics on nursing. I want to be really careful about this. I don't want people to be saying, you have a 5% chance of having a successful nursing experience because you had breast cancer. This information needs to be provided with a lot of care and compassion, even providing it in a handout. I just want to be really mindful of that. And the reality of low milk supply, pain while nursing, and supplementation should also be discussed. Lastly, I think it's important that we are giving our parents that we are informing them and educating them on monthly breast exams. Parents should be becoming really, really familiar with their breasts. And then on the side here, I walk through how to go about a breast exam. So you're going to visualize your breasts in the mirror. You're going to put your hands on your hips. You're going to put them above your head. Even leaning forward and letting your breasts hang can be important to make sure that the breasts are still round. There's no dimples or puckering, which can be a sign of breast cancer. The skin should appear smooth. There should be no abnormalities there. Taking 2 fingers, pressing into the tissue and rotating in a circle all around the breast, even up into your armpit, as breast tissue can be there, and around your nipple. Making sure that there's no abnormal lumps or bumps. It's important to remember that lumps and bumps on your breast are actually normal and that they are there. This is why this breast exam monthly is important, to determine if there's anything new, anything changing, anything that wasn't there last month. And this is just questions I had for the class if I were to present live. Unfortunately, I was not able to. So these are some questions. Has anyone ever worked with a client that has had breast cancer and has decided to breastfeed? How often does your preceptor perform these exams? And is there anything that you learned from today's presentation? And these are my references.